The last lecture for this evening is I present Dr. Prasanth Pillai. I'm very happy to present Dr. Prasanth Pillai, our friend, younger brother, and the ever dynamic Dr. Pillai. He's from Kochi. He's a maxillofacial surgeon by training, and most of you have heard him this morning saying that he has become a basal implantologist by choice. He runs his own center, and his work is very meticulous. So is his record keeping. I think many of you, if you are familiar with his posts in our immediate implantology group and also on Facebook, will know that he is very meticulous. And Dr. Ade has influenced him immensely, and I am sure Dr. Pillai will take the implantology, strategic implantology to greater heights in India along with Dr. Gaur. Yes, now over to Dr. Prasanth Pillai.
Thank you. Thank you, Mahata sir, for the kind words. Now, I thought it is important to give you a rough idea about, how to document cases, which is extremely important. You've heard many experts talking about techniques in basal implantology, in strategic implantology, but at the same time, it's important that we also discuss about documenting our cases, which is extremely important. Now, documentation. Maintenance of dental health records of patients is of utmost importance. It contains sufficient information to identify and assess the oral health scenario of patients, in addition to furnishing evidence regarding the appropriate course of treatment which needs to be or has been undertaken on them. It is the backbone of every dental practice. Documentation classified. You have case records, hard copies or soft copies. You have X-rays, OPG, IOPA, bite wing, CT, CBCT scans, etc., all pre and post-operative. You have photographs and videos. You have patient models. You have medical reports, letters from treating physician, investigation reports. You have letters to the patient's physician seeking medical clearance for the procedures. You have records of communications with the patient, informed consent of patients for undergoing treatment, terms and conditions on discontinuation of treatment, prescriptions, bills and receipts, and finally patient testimonials. All these come under the documentations which we need to, focus on. So you have options of storing hard copies in the form of case sheets. You have provisions to store as Word files on PCs, storing on Dropbox folders and Google Drives, using offline softwares, using cloud softwares like Practo, etc., use of Google Photos, YouTube, etc. And so these are the various methods in which you can document your cases. So, to start with in detail, the presenting complaints. The chief complaint should be recorded in the patient's own words, the duration of the complaint, and also a record of the related complaints. I'm sure all of you are aware of all these things, but I'm just reinforcing these things on you, that's all. You're all aware of all these things. I'm just reminding you about these things, that's all. Now, what are the patient expectations? It is very important to document the patient expectation. The patient comes to you and says, I want a smile like Aishwarya Rai and to laugh like Amitabh Bachchan. That is the kind of expectation they have. Now, for example, this is a patient who came to my practice. This is how she was. You can imagine how the situation was. And finally, myself and Vivek, we did the case together. And the interesting part was, towards the end of the procedure, the patient's expectations were sky high that n number of metal trines could not satisfy